At Genetics and IVF, our program for elective egg freezing is called personal egg banking. And what that means is women can now have a little bit more control over their future fertility by electing to preserve, cryopreserve, or freeze their eggs in their younger years when they intend to get pregnant in their later years potentially. A perfect candidate for elective egg freezing or personal egg banking would be somebody in her 30s, although we can go to early 40s depending on the situation. Generally speaking, the advice of the doctors would be to encourage patients to get pregnant as soon as they can, realistically, to avoid future fertility issues that often come as a matter of age. Age-related fertility problems are quite common. But as it turns out, a lot of women in their 30s are not in a position at the moment to get pregnant. Their career takes precedence, or education, or it just may be a matter of not having found Mr. Right yet. So being able to preserve their eggs while they're younger sort of takes the pressure off a little bit for worrying about will they be able to get pregnant when they're a little bit older. They're essentially acting as an egg donor for themselves. Most often we see patients who want to come in for social reasons, but it can be for medical reasons as well if they know they're going through potentially harmful circumstances such as chemotherapy that could hurt their future chances of fertility. They can freeze their eggs now and come back after their treatment is completed. The process involved in personal egg banking would begin with an initial consultation with the doctor. The patient would come in and discuss the process involved with going through an IVF cycle, which is what you'd have to do to freeze your eggs. An IVF cycle is generally, for the past 20, 30 years or so, has been involved with women who are trying to get pregnant at the moment. With elective egg freezing, a woman would go through an IVF cycle but stop short of fertilizing the eggs or putting the embryos back into her uterus. We would just freeze the eggs once they were retrieved. Once a woman does decide that she does want to begin the process of elective egg freezing, it takes about 2 weeks. In a normal menstrual cycle, a woman would ovulate 1 egg. We want to give her medications to produce multiple eggs so that we can make this process as efficient as possible. These medications are given by injection with a little needle similar to an insulin syringe, and we teach the patient to give those injections to herself, or a friend or family member can give it to her, however they prefer. All that while we are monitoring her response to the medication with blood work testing and sonograms. Women do often ask me if they'll have to take time off of work for this procedure, and the answer is no. We do this in the morning before they would need to be at work. So our morning monitoring appointments begin at 7 in the morning. They can be out of the office by 7:30 and on their way with their day. It takes about 6 to 8 morning appointments during the stretch of about 2 weeks. And after about 2 weeks, we're ready to plan the egg retrieval. And that is the only day they would need to take off of work. The egg retrieval is done in our office under sedation. There's no pain, very, very little risk of complication, less than 1%. Patient's here for about 2 hours, and then she can go home, rest for the day, and then go back to work the following day. The advent of vitrification has absolutely transformed reproductive medicine. It is one of the most exciting new developments in reproductive medicine in recent years. We have over 1,000 babies born worldwide as a result of this technology, with no increase in birth defects or any problems or complications. And they stay in the cryopreservation tank or in the freezer indefinitely. They don't wear out or get freezer burn or anything like that. They'll be safe and sound in the cryo tanks until the woman is ready to use them. The benefit is a tremendous peace of mind. The woman knows that she's done everything she can to sort of press pause on the biological clock. Just having these eggs, quote, in the bank is what we like to be able to offer women so that they can have peace of mind knowing that they've done what they can to preserve their future fertility.